Excessive hair growth, facial hair, as we age. Doctor dismisses it. Some hormone levels are normal, such as cortisol. One, I would definitely take a picture when you are at your hairiest, because a lot of times we go in and we've exfoliated, and so the doctor isn't seeing how severe this is. So taking a good picture at your hairiest, that's the first thing I would do, so they can see how severe the hairiness, or hirsutism is the other name for it, the medical term. Well, when we hit menopause, our estrogen level plummets. Our fat cells and our adrenals are still producing estrogen, but our ovaries are no longer producing estrogen. However, our adrenal glands are still producing testosterone. So what causes the hair growth is our ratio of estrogen to testosterone. Before we hit menopause, the estrogen level is high. Testosterone level is just normal. And then we go through menopause and the estrogen level plummets or goes low. So now you've got a different ratio of estrogen to testosterone in your body. And when your body sees that, the testosterone will have more of an effect. And so we start to lose hair here. We start to sprout hair here. I get like 3 of them that drive me nuts. And we also start to gain weight here. This could be just a normal part of aging. That's why I say take the picture, because that will really help the doctor see how hairy you are. But let's go over some causes that could be causing excessive hair growth as we age. And a big one is if you are taking any steroids. If you are on chronic steroids for medical disorders such as rheumatoid arthritis, lupus, a lot of other autoimmune disorders, that can cause excessive hairiness. If you are taking topical steroids, you've just got some over the counter and you've been using it regularly for a long time, believe it or not, that can cause excessive hairiness. Other causes, just so I can go over them with you, because there were a bunch of medications that could cause these. Minoxidil, Rogaine. Women could be using it in order to improve hair growth on their scalp, and that could cause excessive hairiness other places. Danazol, that's for endometriosis, so that would be for someone who hasn't gone through menopause yet. Diazoxide is a medication for hypertension. So if you're on diazoxide, that could cause excessive hairiness. Cyclosporine, that's usually an immunosuppressant. So anyone who's had an organ transplant, they will be on cyclosporine or Cy-A. That could cause excessive facial hairiness. Dilantin, if you have any seizure disorders and you're on chronic Dilantin, could cause excessive facial hair. And some certain antipsychotics can cause it also. What I thought was interesting, it said especially the long-acting injectables, which are newer to the market. Lastly, DHEA. It's a supplement. I know a lot of women take it because they want to increase their libido, but guess what? It can cause excessive facial hair. So go through your list of supplements, go through your medications, see if you're on any of these that might be causing the excessive facial hair, and then talk with your doctor about whether you can change these up.